All right. Well, good morning, Jeanine.
Good
Um,
morning.
I'm glad that you were able to take some time to visit with me. Jeanine has been working in the healthcare industry for the last 20 years. She was a health unit coordinator, an ER manager, and now she's currently the director of nursing. So I felt that this was probably the best candidate that I could find that has done a lot of different things within the local hospital. On my travels within this district and conversations that I've had with um, constituents here in CD8, which is a very large district, everywhere I went, healthcare, affordable healthcare, and I know that that's not something that you can control. You only control the other side of, well, not control, you work on the other side of it, but then maybe can see the effects of folks that aren't able, for one, to afford the health care, or folks that do have the health care. What effects that you see in the work that you do?
Well, some of the concerns I think we see in the effects are we have a lot of employees that we're lucky in our role in our critical access hospital that our employer is able to help fund some of our health insurance for our employees. A lot of smaller businesses aren't able to do that. We are part of an HMO, so we are able to see physicians within our own organization, which I think is helpful. And then we do get a discount when we do care there, which is helpful for our employees. For our patients around the community, I think it's a struggle because we're finding that because they don't have affordable health insurance, some of them are waiting till they're sicker than they should be to come into our facility, and then we're seeing them in our emergency room instead of trying to do some of that preventative care and trying to catch that before it gets critical.
How do hospitals work with like folks that come in there and they have no insurance? What effect does that have on the care and like fiscally, as far as what does the hospital do with a patient that comes in there? They have no insurance. You
So
can't turn them away.
no. So what we do is we have a financial assistant that works with them. We do a lot of charity community care. We will write off some of the care that patients just can't provide, and that is something that we as directors talk about a lot. How can we provide the care but yet stay functional? We're one of the very few critical access hospitals left that's independent in the state. So how can we maintain that? So it's a constant talking with, we go around and they go and lobby at Washington last year, DC, some of the senior leaders did, trying to get more funding for critical access hospitals to be able to stay independent and support their communities.
So with the understanding that when you're on Medicare, so if it's Medicare for all, what does that do financially to a healthcare when you're only getting 40 to 50% return on the care that you give that patient?
If we show that we are doing annual visits with our patients, if we show that we're doing the pre-screening for like diabetes, hypertension, cancers, and different things like that, within this ACO, each organization gets a percentage, and then we're able to get a little bit of money from that to help decrease some of our spending. And it's going to be things like that. We're going to have to organize with other community hospitals to try to figure out a way to get as much. We know we're never going to get that dollar for dollar payment.
So what I'm hearing is the infrastructure of just our schools alone
That
has determines whether someone really wants to live in this community or not.
it can be, it's the housing, it's the workforce, and it's the schools that a lot of people look for. Because we're just not looking at employing the physician, it's their spouse as well. And a lot of these are potentially younger physicians that have young children that are coming in, and that can be a big concern, yes.
So I know that there's some states that have started to open up different businesses that were held that were closed.
Mm-hmm.
I guess I'm I'm fearful of what lies ahead because I don't think that we're ready. Because I sense that if we open things up, it's going to be worse than the first round. What are your thoughts?
My thoughts is we haven't even seen in Minnesota yet. We haven't even seen the worst of our first round. So I'm a little hesitant as well. We've got to take care of our community. We've got to take care of our patients. But how are we going to do that safely? And that's doing it, finding those patients that need to come in first, that are in the most pain, that are having those concerns, and get them in and keep it as safe. We still have a restricted visitors within Riverwood. So it's a daily challenge, and what we think is going to be the right move in the morning may not be the right move in the afternoon. So it's constantly changing.
Everything needs to work, and people shouldn't lose sleep trying to figure out if they have a job or if we're going to be able to continue to provide the great services that Riverwood alone provides for our community.